1.5 hours north of Nashville. Her blood was cultured unsuccessfully. And the antibiotic 32 agent typical spiral sheet disease. Okay, this is spiral sheets. And we need to use a dark field microscope to do. What are the 3 spiral sheets we talk about? Borrelia burgdorferi, Treponema pallidum, and the Leptospira interrogans. So what is that? If you see a circular rash, like this, what's that? Borrelia burgdorferi is right. So the answer right here. Okay, that's Warren County, Kentucky, 2010. Yeah, I remember. It's these questions in 2010. So I identified the 31 person who have a diarrhea with visiting a beef cattle operation in Warren County. And what they end up with? Hemorrhagic uremic syndrome, HUS. And these, you spread the protein onto McConkey agar, is lactose positive. Okay, then what is that? Which pathogen causes hemorrhagic uremic syndrome can grow on the McConkey agar? This is the pathogen everybody will know. E. coli 0157H7. Okay, so that's one. 60-year-old male, go to the hospital, prostate surgery, complaining of dysuria. It's difficult to pee, okay? Urine sample, E. coli is the significant numbers. But that does not mean it's E. coli, okay? They just don't see it, they said it's E. coli. So urinary tract infection removed before patient, do the AB toxin test. We see water, looseless stool cramping, abdomen pain, and dip. Water diarrhea, you can say. Okay, diagnosed with pseudo membrane colitis because they are typical antibiotic therapy. A fecal transplant they did. It's a horrible treatment for fecal transplant. What is that? Clostridium difficile. Is that right? The 3 methods for treatment: fecal transplant, drink yogurt, and we use what? Vancomycin. Then you go back to see the mechanism of vancomycin. What is that? Okay, so this is a question. These question basically is reviews slides 2, all these passages. Okay, which one is this? In a gas generator, anaerobic environments, double beta hemolytic zone. Look at here, double beta hemolytic zone. What's that? Clostridium perfringens. Okay. 2012, FSIF announced it's taking new steps to fight E. coli, protect the safety of United food supply. Which step protect the United food supply based on your knowledge? This one I mentioned, but just the external knowledge for you. 6 additional serogroups of E. coli was declared adulterant in non-intact raw beef. That's a big 06. Okay. Who is usually credited the discovery of penicillin? Little bit of history. Fleming, is that right? Okay. Chemoretic agents that are natural products of microorganisms are most specifically referred to as what? Antibiotics or antimicrobial agents? Antibiotics should be. If you forgot, let's go back to see the slides. So I may forgot. What is that? Antibiotics, is that right? So that's antibiotics. Chemotherapeutic agents that are artificially produced but are mostly speakily referred to as antimicrobial agents. Yeah? Or chemical synthesized. The lowest concentration of an antibiotic that prevents growth is called, I said it's very important, the 3 methods to test, is minimum inhibitory concentration. Okay, one of the methods is E-test. How we do it? a qualitative antibiotic sensitive test that utilizes plastic stripes impregnated with an antibiotic of interest. So that is B. Okay. The most selective antimicrobial agents are those that infiltrate bacterial cell growth synthesis. That is because it's a very simple question. I ask you, there are so many mechanisms. Which one is the most important one? Attacking the cell wall. Why? Bacterial cell wall have a unique structure, not found in eukaryote host cell. That's a big deal. Sulfamide and other drugs inhibit folic acid synthesis, have a high therapeutic index because of what? Because humans synthesize folic acid by process. They do not synthesize folic but obtain it in their diets. I would say this is the answer should be by process that is not scientific, should be B. Okay, synthesis folic acid but obtain it in their diets. Vancomycin, the last question. What's the vancomycin did? Inhibit the transglycosylated reaction peptide glycan biosynthesis. Interfere with the action lipid layer. This is not. This is the basic tracing, okay? Transpeptidation reaction. What is that? Yeah, that should be the answer. Transpeptidation for vancomycin. So if you forgot, let's go back to see it. Right here. What does the vancomycin says? Is that right? Yeah, the side chain interfering with peptidoglycan. Amino acid is a side chain. Okay? So we have to go back to see the transpeptidation, transglycosylases reaction with not this one, not this one. Transpeptidation reaction. Okay, transpeptidation, we call it a transpeptidase. This is for, the C should be for penicillin. So I would say the answer here, maybe A is a better one. Okay, transglycolysis reaction. So look at here. Yeah, that's a transpeptidation. Okay, so the A is a good one. Okay, that's all I have. If there is some answer which is different, I'm going to post the key there. You can refer to the key, always. Okay, maybe one or two questions. Definitely do these practice questions. Not for the remember the answer, but the case study will be very similar. I would say you have a study group over the weekend to do it. And for yourself, when you find it's A and it's B or it's C, or specific for that pathogen, do a conclusion. You can put them all together to study. It's all going to be to cover all these things. The major pathogen will not be giving some weird name. All the symptoms will be very typical. Okay? So that's all I have.